Well, hey guys, Matt Goss here. It's been 9 years since my last procedure on my right hip, and I'm finishing up and should be discharged here today. This is my second day. I just had my left hip, another BHR resurfacing procedure, so I now am a bilateral BHR patient, as they would say. My surgery yesterday was about at 12:30. I was walking right at about an hour after surgery, using crutches this time. And they did a different procedure for anesthesia. They did a neuroaxial anesthesia, which basically is like a spinal tap or more like an epidural, excuse me. And I was asleep, well, kind of out of it for the surgery. But yeah, way quicker recovery time. You don't have the, you're not intubated, you're breathing on your own. They cover your head. I mean, I was awake a couple times, but there was no pain from it or anything like that. So you're kind of aware you're in surgery. You can hear some conversations at the time. You might have a memory of some of that very, very short, but when I came out of it, I have no recollection of anything that was talked about. Obviously, they're very professional. Music playing in the background is always nice too, but yeah, I got up last night and I walked, was able to go to the restroom, no problem. Again, a lot of the result of what you're probably going to be reading of having a epidural instead of general anesthesia. Much less bleeding, way quicker recovery times. You get discharged quicker. Normally, this is an outpatient surgery. Unfortunately, I live 4 hours from the surgery center here in San Francisco. I live north in Redding, California. Maybe 3.5, but 4 hours with traffic. So they didn't want me to drive that long the same day of surgery. But normally if I would have had an 8 a.m. surgery, 9 a.m., 10 a.m. even, I would have been discharged same day. So it's very common now with the spinal anesthesia. So highly recommend that. And if your doctor isn't doing that, he's old school, and that's okay. Nothing wrong with general anesthesia, but you will have a little bit longer recovery time in the hospital, probably at least a 2, if not a 3-day stay. And if you're maybe an older patient or something like that, it may even be a day or 2 longer. But it's been great. I just got done with PT this morning. It's about 6:50. Yeah, 10 till 7 or so. I'm gonna have breakfast soon, but I did a lot of walking. Probably walked, I feel, about 50 yards, 70 yards or 75 yards. It's been really good so far, so I look forward to updating you on my progress, and I'll make sure I tag all the other videos below from 9 years ago, my first procedure that I had, which was great as well. Dr. Levingood at Sports Medicine South did that one, and then this time I had Dr. Peter Callender and his PA John Walker from California Pacific Orthopedics. They're in San Francisco, and they're excellent. He is a specialist in the BHR. He actually trained under David McMahon, and if you know that name with the BHR, at the McMahon Institute, he basically pioneered and invented this procedure. So I was very fortunate for that. There's no doubt about it. But anyway, I'll check in with you soon. Appreciate you guys walking. Please subscribe. Please feel free to send me a message. I'd love to be a resource to help you. I know that it's kind of scary, especially your first one. But honestly, with the new anesthesia technique, please look it up. There's tons of studies and data on spinal anesthesia versus general anesthesia for hip and joint replacements. So great to see you guys, and I'll talk to you soon.